Akan, Dr. Felix dan Dr. Lin. Sebelumnya saya akan memperkenalkan Dr. Shi Juling. Dr. Shi Juling, he was graduated from National Chiltern University, and then also graduated from the University of Queensland, Master of Veterinary Study, Diagnostic Pathology in Australia. His work experience now at Doolittle Animal Hospital. Also current work at Little Prince Animal Rehabilitation Hospital. We would like to invite Dr. Felix and Dr. Juling to the front. So from now on, the main event will take over by Dr. Felix.
Okay, good morning, everybody. It's my first time in Jakarta, and you can call me Johnny, which is a lot more easier than calling me Jiulen. And it's a great honor to be invited by RWD and Dr. Murdawa. Murdawa. And I just arrived yesterday, and I can feel that it's very hot in Jakarta compared to Taiwan. Yeah, and today I'm going to share my experience of laser therapy in small animals.
Oke, ya. Jadi nanti ke depannya untuk presentasi dari Dr. Lin, saya akan mencoba untuk menginterpretasikannya, disummarize sedikit ya. Nanti kita akan ada pitstop-pitstopnya dalam bahasa Indonesia seperti itu ya dokter-dokter sekalian. Okay, can start?
Yeah, okay. So I just want to ask that thank you. So how many people have using laser therapy now?
Berapa orang yang pakai laser terapi sekarang?
Oh, that's quite a lot.
That's all.
Yeah. Okay. So personally, I have used laser therapy for about 7 to 8 years, and it works very well in patients with orthopedic problems or neural problems. And even though when there's what Dr. Felicia showed us, if there is a wound or inflammation, you can use laser therapy to treat these patients.
Jadi sudah 7 sampai 8 tahun dokter ini menggunakan laser terapi. Biasanya itu dipakai sangat baik ya pada ortopedik dan juga untuk luka-luka gitu seperti yang sudah dipresentasikan.
So today I will be talking about the basic of laser therapy and to let the doctors know how to use it and how to use it correctly and safely.
Jadi hari ini kita akan bahas tentang basic laser terapi supaya gimana caranya kita dokter-dokter bisa menggunakannya dengan benar dan dengan
Okay, so this is myself. I graduated in Taiwan for my vet degree. Then I went to Australia to study, and currently I have doing rehabilitation for about 8 years, and I'm a CCRP as well. And I think I've done some speaking lectures in Taiwan, and I did some workshop in Kuala Lumpur this year, and I was the speaker of that show last year in Singapore.
Jadi Dr. Lin ini sudah lulus dari master degree-nya, kemudian juga dia punya gelar ya CCRP untuk rehab dan juga manual terapi. Kemudian juga Dr. Lin sudah pernah mengisi di berbagai seminar di luar negeri juga.
So I just want to show you guys our clinic. Here is where I work, and our clinic is very different to the traditional animal clinic. We have a reception, and here is where the owners sit, and here's a huge TV, because when we're doing rehabilitation inside the consult, this is our consult room. We don't even have a table to put the animal. We just let them freely walking in the room. and we have 3 rehab consult rooms, and this is our underwater treadmill room.
Jadi ini adalah ruangan-ruangan yang ada di kliniknya Dr. Lin. Mereka di ruangan konsulnya itu bahkan nggak punya meja ya, semuanya jadi bisa jalan-jalan gitu. Terus juga di ruang tunggunya disediakan TV.
So let's move. So this is what my works. This is what I do every day. So because I only do rehab consultations and rehab sessions. So what we do, this is a treadmill. This is an underwater treadmill, and we do laser therapy, and I do like manual therapy for our patients.
Nah, ini yang dilakukan Dr. Lin setiap harinya karena Dr. Lin ini spesialnya hanya menangani rehabilitasi ya, kasus-kasus rehabilitasi. Jadi ini yang dilakukan ada water treadmill, terus kemudian juga ada treadmill walking, terus juga ada di hydroterapinya.
And this is what we showed to the owner outside the screen because the owner would not stay with us in the same room. So you can see there is like a camera recording the time and what we're doing to our patients, so we can record the patients every time and we can have a record.
Jadi semua treatmentnya itu direkam ya supaya nanti bisa dikasihin, supaya nanti ownernya bisa melihat. Jadi ada track recordnya juga.
I think here are some videos I can show you guys here. So we're helping this dog to walk. And this one is the underwater treadmill.
Jadi video-video waktu dilakukan pengobatan ya.
And this one is the laser therapy. And the last one, this one. Yeah, it happens sometimes because when we're touching, evaluating this patient, this dog might feel where it's a little pain. So yeah, it happens sometimes.
Biasanya bisa sering ya suka terjadi ya kalau ketika disentuh itu ngerasain sakit, jadi ya pasti akan seperti itu reaksi.
So if you guys are very interested in physical therapy in small animals, these 2 books are very important, especially the last one, the canine rehabilitation and physical therapy, and it has every information you want to know about physical therapy. So I think they have a online session, so you can online edition, so you can find it online. And this one is more like a more focused on the sports medicine. So these 2 books, if you guys are very interested, you guys can have a look at these 2 books.
Buat teman-teman, buat dokter-dokter sekalian yang memang tertarik di bagian rehabilitasi, 2 buku ini bisa menjadi referensi. Yang sebelah kanan itu ada tersedia online, atau yang sebelahnya ini ada online atau enggak, tapi yang sebelah kirinya itu khusus untuk sport terapi.
And what is CCRP? How many people has heard about CCRP?
Ada yang sudah pernah dengar CCRP?
Okay. So CCRP is an international course about small animal rehabilitations, and it's all around the world. And CCRP is a course that you, first of all, when you enroll the course, you have to finish your online course. And the online course, I think it's quite long. It takes months to finish all the online course. And after you finish your online course, you join the workshop for 5 days, and then you finish your workshop. Then you have to write 5 rehab case reports. Then you go to the CCRP certified clinic to do your internship, and you take an exam to get your certificate. So it's a very good course actually, but it takes a lot of time.
Jadi buat dokter yang mau punya pendidikan berkelanjutan di rehab, ini bisa jadi salah satu tujuannya ya sisi arti ini. Cuma memang pembelajarannya agak panjang, online dan onsite. Onsite-nya itu di workshop ya sekitar 5 hari, kemudian perlu melakukan laporan kasus, perlu dibikin juga laporan kasus, kemudian harus magang juga di klinik-klinik yang memang ditunjuk untuk sebagai rekanan sisi arti.
So, okay, let's start today. What is physical therapy? The physical therapy is actually the treatment of problems of the muscles, joints, nerves, and especially using some exercises. And the treatment of this disease can help these people with it if they have any like deformity or they have any injuries. They can make the best use of their left hands and to improve their life quality.
Ya, jadi ini terapi fisik ya, biasanya itu dipakai untuk masalah-masalah otot, sendi, terus saraf-saraf juga untuk meningkatkan kualitas kehidupan mereka.
So before you do any physical therapy, your definite diagnosis is very important. So X-ray is very important before you do any physical therapy. You have to know if this is a cruciate ligament rupture or this is a hip joint osteoarthritis and this is like a spondylosis of your spine. You have to make sure what you are treating. So when you're using your laser therapy, you can focus on what you are actually treating.
Ya, jadi sebelum melakukan physical therapy, kita harus punya diagnosa pastinya dulu. Jadi X-ray itu sangat penting untuk mengetahui apakah itu ada ruptur di TCL-nya atau spondylosis atau yang lainnya, supaya waktu kita melakukan laser terapi dengan laser juga itu dilakukan dengan tepat.
So why we're using laser therapy? Why is laser therapy so useful and important?
Jadi kenapa nih laser terapi itu sangat penting dan sangat berguna?
So what is laser? Laser is what we said is light amplification by stimulated emission radiation. And nowadays we have a new term. We call it photobiomodulation therapy. Use cold laser or low level laser, and in the old terms.
Jadi laser terapi ini adalah amplifikasi cahaya dengan radiasi yang terstimulasi. Nah dulu itu kita sebutnya terapi laser dingin gitu ya, atau laser terapi, tapi sekarang biasanya disebutnya fotomodulasi terapi.
So the classification of laser, we have 1, 2, 3A, 3B, and 4. So what we're using now is mostly class 4 laser. The class 4 laser is if the power is more than 500 milliwatts, which is classified to grade 4 laser. And I've seen Dr. Felicia's case study. They are all wearing the goggles, which is very good because class 3B or class 4 lasers may harm our eyes when you're directly seeing the laser beam. So the goggles is very important for class 3B and class 4.
Jadi laser ini punya 5 klasifikasi yang biasa kita pakai itu di klasifikasi yang keempat ya. Jadi waktu menggunakan laser terapi ini harus pakai kacamata juga karena nggak boleh langsung melihat cahayanya itu dengan mata telanjang karena itu bisa berbahaya.
And it's also the class 3B and class 4 laser, which has enough power for us to treat the patients with orthopedic problems or tissue injuries.
Ya, kalau dari kelas 3B sama 4 itu punya energi yang cukup untuk bisa mengobati pasien.
Okay. So when the laser hits your skin, there is 4 things that can happen. Some energy you will actually strikes back, which we call this reflection, and some will penetrate all the way without interacting with the cells, and some will be scattered, and about 20 to 40% that gets absorbed by the tissue, which just shows you there is biological effect. This is the most important theory of laser therapy.
Jadi ketika laser itu mengenai jaringan itu ada 4 hal yang bisa terjadi, itu refleksi, kemudian juga dipenetrasi, tersebar, dan sekitar 20-40% itu mengalami biological efek biologis atau diserap, gitu ya. Itu yang kita butuhkan, yaitu penyerapan.
So when you are doing the laser therapy to your patients, you want to prevent the scatter and the penetration and the reflection as much as possible.
Ya, ketika melakukan laser terapi, kita itu mau menghindari efek-efek yang lain, dari refleksi, penetrasi, dan juga yang tersebar.
So ideally, it's better to have your patient's hair shaved. Ideally, but nowadays it's very difficult for the owners to like ask them to shave their hair before doing laser therapy. So when I am doing the laser therapy, it's better if there is no wound on the skin. It's better you have a direct contact to the skin and to pattern to part the hair, alright?
Jadi idealnya kalau bisa itu rambutnya harus dicukur. Cuman kan sekarang sulit ya kalau untuk mencukur pasien. Jadi seenggaknya kalau ada luka gitu harus nempel dari propnya ke lensanya tuh nempel ke propnya atau di bagian yang memang ada luka.
So this is the photochemical effect of the laser therapy. So like it activates the ATP and it impacts the cellular and majority of heating, and it also increase the circulation, and the nitrogen oxide is very important for treating these injuries.
Jadi laser terapi ini meningkatkan ATP, kemudian bisa membuat vasodilatasi juga, dan sangat penting itu memproduksi nitrogen itu ya.
So when you're explaining the laser therapy to your patients or to your patient's owner, it's very important to let them know what laser is actually interacting. It goes to the cells, and the cells absorb the energy, and it causes the mitochondria to produce enough energy for your cells to heal and to increase the circulation of your blood and to make the best of it.
Jadi sangat penting kita harus menjelaskan ke owner dulu gimana caranya si laser terapi itu bekerja. Jadi ketika di laser, energinya itu akan terserap masuk ke mitokondria supaya nanti di situ akan terjadi penyembuhan dan perbaikan jaringan.
And sometimes, like in my clinic, the owner will ask you, how about they use like the red light for treating like the hot pet injury? What is laser compared to that? Compared to use the commercialized red light treatment, it's completely different because laser they have a specific wavelength that treating the specific cells and absorbed by specific cells. And the red light, they're just using the hot therapy. It's not working with the cells directly.
Jadi kadang datang owner nanya apa bedanya sih antara laser dengan kompres panas atau terapi panas gitu ya, terapi cahaya itu sangat berbeda karena kalau laser dia spesifik ke sel tertentu dan energi tertentu dengan panjang gelombang tertentu, tapi kalau dengan terapi cahaya itu sangat-sangat berbeda.
So the photon is absorbed by the cell, absorbed by the mitochondria at the cell membrane. So oxygen production and the formation of proton gradients across the cell membrane and across the mitochondria increase the ATP levels, DNA production, and change in cell membrane permeability.
Jadi foton itu akan diabsorpsi di mitokondria di bagian sitokromnya, kemudian nanti oksigen akan diproduksi dan formasi gradien proton itu akan melewati membran, dan membran mitokondrianya akan meningkatkan nilai ATP, produksi DNA, dan juga mengubah permeabilitasan dari si sel membrannya.
So this is pretty much the same, the photochemical effect. enzymatic activation, increased ATP, cellular metabolism, and oxygen activation.
Jadi efek fotokemikalnya sama ya, mutasi enzimatik, kemudian ATP-nya juga akan ditingkatkan, metabolisme seluler dan juga aktivasi ion.
Okay, now we goes to the photothermal effect. So occurs when absorbing the photons by the chromosomes, and it also when your photons hit the tissue, it can absorb by three different things. It can absorb by the hemoglobin, it can absorb by the melanin, it can absorb by the water.
Jadi nanti waktu lasernya itu kena ke sel, dia akan diabsorpsi antara hemoglobin, melanin dan juga air.
So the photons is absorbed by these three different things. And if your photons is absorbed by water and melanin, it produces heat.
Ketika fotonnya itu diabsorbnya ke melanin dan juga air, dia akan menghasilkan panas.
And what we want as many as photons absorbed by the hemoglobin to produce the photochemical and to produce the photochemical effect.
Jadi yang kita mau itu fotonnya sebanyak mungkin terabsorpsi di hemoglobin supaya nanti bisa menghasilkan efek fototermik.
Okay, so now we talk about thermal therapy because our patients, they have melanin and they have water. So when the laser therapy produces heat, it happens, but you want to make sure your heat is not too hot and heating your patients. So when you're doing the laser, you feel that if the degree is less than 43 degree, which is safe and it has a good blood circulation.
Jadi ketika melakukan laser terapi itu pasti akan menghasilkan panas. Nah itu oke kalau dia di bawah 43 derajat.
So if the temperature is too high, it can be irreversible and it can cause some burning injuries to our patients.
Kalau lebih tinggi dari itu bisa menyebabkan irreversible dan juga bisa menyebabkan luka baru.
So here is another slide for the photothermal therapy. So if your temperature is less than 43 degrees, there's no damage, and it can increase the biochemical reaction and rates. However, if it's higher than 45, it starts to change the membrane permeability and reduce the enzyme activity, and it can be vaporization of your collagen.
Jadi yang paling aman itu di bawah 43 derajat Celcius ya, di mana tidak adanya kerusakan dan juga reaksi biokimia itu meningkat. Tapi kalau di atas 45 derajat itu udah ada perubahan permeabilitas membran, kemudian juga bisa menurunkan aktivitas dari enzim.
Has anybody experienced hot spring? When you go to Japan, you have to stay in their like hospital.
Oh yeah, sauna.
Yeah, so the sauna, right? You call it sauna. Okay. So if you're going into the hot spring water, most of the hot springs temperature is less than 45 degrees, right? So you can keep this in mind. If it's higher than 45 degrees, it's gonna be very hot, and your skin will definitely burn. So when you're doing the laser therapy or you're doing the hot pack therapy, just make sure your temperature is less than 43, which is good enough.
Harus pastikan di bawah 43 derajat, kayak seperti sauna ya. Kalau lebih dari itu nanti bisa membakar jaringan-jaringan sekitar.
Okay, so this is the photo. Then we are talking about the photomechanical effect. So in RWD laser, they have the continuous wave or they have the pulse duration, and this may related to our photomechanical effect.
Jadi untuk RWD itu punya gelombang yang berkelanjutan terjadi atau juga ada yang close, itu akan berpengaruh sama treatment yang kita berikan ke pasiennya.
So if you have a laser pulse duration less than 1 millisecond, it's used in surgery, and you can do the like PRK. You guys know about PRK? When you're doing the nearsighted eye surgery, you're doing this PRK, and it's not actually hot. It's not heating when you're doing a very short pulse.
Jadi kalau pulse-nya itu yang pendek, kurang dari satu mikrosecond itu ya, itu dipakai untuk operasi, dan itu tidak menimbulkan rasa sakit.
And if you're doing the continuous laser, it causes some thermal effect.
Sedangkan kalau pulse-nya yang panjang atau berkelanjutan yang menimbulkan efek thermal.
So some people will ask that what's the difference between using pulsed or non-pulsed? Actually, there is both evidence in pulsed lasers, and they have different effects. However, it both has a very good effect when you're using the pulsed or non-pulsed.
Jadi ada yang nanya nih bedanya yang pakai pulse dengan yang tidak berpulse itu apa bedanya? Dua-duanya itu sama, ada yang memang bagus pakai pulse dan ada juga yang berpulse.
So the RWD laser machine, it combines with the continuous wave and the pulse wave, which has the advantage of both different pulse and non-pulse wave.
Jadi semua yang pulse dan non-pulse itu punya keunggulannya masing-masing, dan RWD ini punya keduanya.
So in clinically, there is three main therapeutic effects of laser therapy. It's got anti-inflammatory effect, anti-edema effect, and analgesic effect.
Jadi efek terapi itu ada anti peradangan, anti edema, dan juga analgesic effect.
Also, it's very useful for tissue repair. It causes the vessel dilation and increase the supply of oxygen, nutrients, and growth factor.
Jadi untuk laser terapi juga bisa bagus untuk perbaikan jaringan, yaitu salah satunya vasodilatasi, ya dapat meningkatkan pasokan dari oksigen, nutrisi, dan juga faktor pertumbuhan.
And it modulates the inflammation and trigger the subsequent steps of wound healing.
Jadi memodulasi peradangannya juga supaya bisa merangsang aktivasi dari perbaikan luka.
Okay, and it also stimulates the fibroblast migration and activation. So this is very important. So if you're doing a fracture surgery, you can do laser therapy to increase the time of bone healing as well.
Jadi ini yang paling penting, merangsang migrasi dan juga aktivasi dari fibroblast. Jadi nanti kalau ada orthopedic surgery bisa dikombin dengan laser ini supaya mempercepat kesembuhan atau pembentukan tulangannya.
And increasing the ATP production, which is we have talked about a lot.
Juga meningkatkan produksi ATP akan kita bahas selanjutnya.
Okay, and how laser work on orthopedic patients? It can increase the serotonin. Everybody knows that serotonin is a hormone that decrease the pain.
Jadi akan meningkatkan serotonin. Serotonin itu hormon untuk mengurangi rasa sakit.
And the beta endorphin release and decrease the bradykinin and have a analgesic effect on the nerves as well.
Juga akan memberikan efek melepaskan beta endorfin, kemudian memberikan efek analgesik dan juga mengurangi bradykinin.
And here is also for neurological patients, it can actually increase the nerve regeneration and promote axon sprouting and mild inflammation.
Jadi ini untuk pasien neurologi juga bisa dilakukan untuk memperbaiki sarafnya ya.
And increase the cartilage production by increasing chondrocytes and collagen production. So this effect is very useful for your old patient with osteoarthritis because their cartilage has been broken down.
Nah, ini bagus juga untuk osteoartritis dan juga geriatrik pasien. Dia itu bisa meningkatkan produksi tulang rawa dan juga meningkatkan produksi kondrosit serta kolagen.
And lastly is the proliferation of the osteoblast to treat the bone repair.
Itu bisa untuk mentreat repair bone repair.
So this is how we do laser therapy. Okay, so this one is so this is what I just said, that for optimal penetration, the patient's hair should be clipped to prevent interference of and to allow optimal penetration to the veins of 50 to 99 of the light may be absorbed by the hair.
Jadi ini yang diomongin sebelumnya ya, jadi semua rambut itu sebenarnya harusnya di clip gitu supaya bisa memaksimalkan penyerapan dari cahaya itu.
So if your patient's skin is the hair is not clipped, you should be contact the patient's skin directly when you're doing your scanning.
Kalau rambutnya nggak bisa dicukur, itu ya mau harus nempel antara si lasernya dengan permukaannya supaya ya nempel.
So it works very well for those patients having surgery, like orthopedic surgery, or even you do a soft tissue surgery because you have already clipped the hair. So when after surgery, you use your laser therapy to treat pain or tissue healing, it works perfectly.
Ini sangat bagus kalau setelah operasi ya, karena kan waktu operasi dicukurin dulu tuh rambutnya, nah itu sangat membantu.
So I think this is the video for us treat. So you see, because on this video the dog's wound has already been healed. This dog did a TPL surgery for cruciate ligament rupture. So I put my probe directly to the entire knee area to decrease the inflammation of the surgical sites.
Ini pasiennya baru selesai dilakukan operasi CCL, nah itu probnya diarahkan langsung ke area lutut supaya mengurangi radangan.
So let's talk about the wavelength.
Ayo kita ngomongin tentang gelombangnya.
So do you remember that RWDs they have 4 different wavelengths of their laser laser, and all the wavelengths are within 600 to 1,000 nanometer.
Jadi tadi kan sudah sempat disinggung ya, RWD punya 4 panjang gelombang. Ya, nah yang jadi yang 600 sampai 1000 wavelength itu tadi kan sempat disinggung.
So why the wavelength should be within this range? Because what we talk about is we want the most immunoglobulin to absorb the photon and the lead of melanin and water. So it's inside this range. We want the most of the hemoglobin absorption and the leads of melanin and water. So the wavelengths should be within 600 to 1,000 nanometer.
Jadi di range yang tadi itu gelombang panjang gelombang yang paling optimal waktu supaya hemoglobinnya itu bisa diserap, lasernya itu bisa terserap oleh.
So if your patient is a black dog, or with the skin color is black, when you're doing the laser therapy, you can feel there is more heat production.
Jadi kalau pasiennya itu kulitnya atau rambutnya hitam gitu, itu akan terasa lebih panas.
So you have to be very careful when you're treating your patients with the dark skin because melanin absorbs and it produces heat. So if they're in dog or dark skin cats, there is more melanin. So if you're doing the laser therapy, stay at one place for too long, it can cause some danger.
Hati-hati kalau mengobati pasien dengan kulit yang agak gelap ya karena dia mempunyai melanin yang cukup banyak. Jadi itu kalau kita berhenti di satu tempat terlalu banyak, terlalu lama, itu bisa menyebabkan kerutaan juga.
So when you're seeing other brand of your laser machine, you must check whether the wavelength is within 600 to 1000 because this is the most important of our laser therapy.
Jadi kalau mau pakai merek lain, itu boleh dicek ya wavelength-nya, panjang gelombangnya apakah ada di range ini atau enggak.
Okay. So here is the suggested doses of laser therapy. We can see when you're doing the analgesia for muscles, it's 2 to 4 joules per centimeter square. And if for acute pain, it's 4 to 8 joules per centimeter square for chronic pain.
Nah, ini jadi dosis-dosis yang memang dianjurkan untuk masing-masing kasus ya.
So I will explain to you guys how to calculate the joules per centimeter square.
Jadi akan dijelaskan gimana caranya bisa menghitung joule per centimeter square.
So when you're doing the laser therapy, you must calculate how big of your treating area is.
Jadi waktu melakukan laser terapi harus dikalkulasi dulu nih, dihitung areanya seberapa besar yang mau dilakukan pengobatan.
I'll give you an example. Do you guys know about the poker cards?
Poker, ya, kalau poker cards ya.
One poker card is about 50 centimeters square.
Satu poker cards itu kan 4 cm persegi.
So when you're treating your knee, maybe it's 100, maybe 2 poker cards. So it's about 100 per centimeter square. So 100 per centimeter square, you times 4, it's 400 joules per centimeter square. So that's how you calculate, how you set on your automatic machine.
Jadi nanti tinggal dikaliin aja berapa kira-kira luasannya itu dengan 2 sampai 4 joule, itu nanti akan dapat seberapa besar kita memberikan laser terapi.
So for these suggested doses, it's recommended. But in my personal experience, you can increase the suggested dose a little bit to make your effect better.
Jadi ini kan dosis yang dianjurkan, tapi sesuai sama pengalamannya dokter ini bisa dinaikkan supaya bisa mendapat efek yang lebih baik.
So in your RWG machine, they have a set area, and they have their suggested dose. I think you guys can start it from that dose, and if you feel like after 3 or 4 sessions, if there is not much improvement, you can increase it by 25%.
Jadi di mesin laser RWG ini udah ada pilihan-pilihannya, bisa dimulai dari sana, tapi ketika setelah 4 sesi itu kelihatannya kok kurang, itu bisa dinaikkan sekitar 25% dari dosis yang dianjurkan itu.
But before increasing the doses, I think it's better for you guys to follow their protocols to prevent further injuries like burning or some other complications.
Sebelum naikin dosisnya itu kita sebaiknya yang ngikutin dulu aja dari dosis anjurannya supaya nggak ada efek-efek berkelanjutan.
Okay. So this here is the poker card. Okay, that's all about this slides actually. So determine the number of joules per centimeter and total joules. It's at the length of your laser therapy. So, for example, if the treatment size of a play card is actually 57, but for me, I think it's about 50. So with 10 joules per centimeter square, so the total is 600. So you're using the 600 for a 10-volt laser, the treatment equals to 50 seconds. Because 600 joules divided by 10 volts unit hour is 60 seconds.
Ini jadi hitungannya ya, bisa dilihat di depan, nanti tinggal harus tentuin dulu luasannya seperti apa, nanti bakal dikaliin dan nanti akan dapat 600 joule kurang lebih. Kemudian nanti akan dibagi untuk mendapat berapa waktunya.
Do you guys have any questions about the calculation?
Punya pertanyaan dengan kalkulasinya?
We can, in the afternoon, we're going to do a workshop and I can show you how do you calculate the entire, the doses, because the doses is quite important when you're doing the laser therapy.
Jadi nanti siang akan ditunjukkan ya gimana caranya kita ukur, ngitung dosisnya supaya tepat.
And here, the hair and the skin color are important because light of the shorter wavelengths is absorbed more by melanin.
Warna rambut dan kulit juga penting karena cahaya dengan panjang gelombang yang lebih pendek itu lebih banyak diserap oleh melanin.
This, you see, if the wavelength is shorter, more of the it will absorb by the melanin more and increase more. It causes more like thermal therapy.
Jadi kalau bisa lihat ya panjang gelombang yang lebih pendek itu bisa diserap melanin itu lebih banyak.
Okay. So there's a contraindication of laser therapy. Do not use the laser on the following conditions, which is very important. First of all, do not use it direct to the eye.
Jadi ini yang perlu diperhatikan waktu melakukan laser terapi, jangan melakukan laser terapi pada kondisi-kondisi seperti ini, yaitu yang pertama nggak boleh langsung ke mata.
And secondly, do not use it on malignant tumor.
Boleh dipakai waktu ada tumor atau seperti tumor.
So when I talk about do not use on malignant tumor, some doctors will ask me that if I resect a MCT, mast cell tumor, which is or a squamous or SCC, squamous carcinoma, squamous cell carcinoma, or I remove a lymphosarcoma, which is all malignant tumor. When I completely resect those tumors, when the wound is healing, can I use laser therapy to treat them?
Jadi kalau pernah ada yang nanya kalau ada kasus tumor tapi tumornya udah diangkat nih, tumor ganas sudah diangkat, bisa nggak kita pakai laser ini untuk terapinya?
My answer is no. Yeah.
Tidak ya.
Okay. But however, today if there is a dog or cat, they have a internal tumor, such as like spleen tumor. If you remove the spleen tumor and you want to use the laser therapy to treat their incision, my answer is yes.
Jadi kalau tumornya itu di organ-organ dalam, terus tumornya udah diangkat, boleh nggak digunakan laser terapi? Boleh, tapi untuk mempercepat persembuhan insisinya.
Okay. So pregnancy, do not use it directly. Use it to scan the fetus.
Ya, nggak boleh dipakai waktu kehamilan langsung ke arah fetusnya.
And thyroid gland.
Kelenjar tiroid juga nggak boleh.
And the epiphyseal plates. This happens all the time because small dogs or young animals, they sometimes break their bones very easily. So if your patient is less than 5 months, I think laser therapy would not actually be a very good treatment for them because the laser therapy can have an effect on the bones when their epiphyseal plate is not completely closed.
Jadi lempeng epifisisnya juga harus dihindari ya. Jadi untuk 5 bulan ke bawah itu tidak disarankan karena nanti bisa punya efek si laser ini ke pertumbuhan tulangnya.
Sometimes it can cause the acting of your epiphyseal plate and causing a longer bone compared to the other side. It can stimulate your epiphyseal, so you will have a longer leg on that side.
Oke, jadi nanti bisa lebih panjang gitu ya bagiannya.
But if your epiphyseal plate is already closed, then it's okay for you to treat with the fracture.
Kalau epifisial plate-nya udah tertutup itu boleh.
Okay. So when can you do the rehabilitation? When? What time?
Ya, jadi kapan waktu yang tepat untuk kita lakukan rehabilitasi?
So the phase 1, you can start it from the acute inflammation. You can start it from the subacute, consolidation or organization phase, you can use laser therapy on all these phases.
Jadi laser terapi bisa digunakan di semua fase ini sesuai sama waktunya.
So here is a photos about this is the video of the same cat. This cat has a carbon joint osteoarthritis.
Ini video dari kucing yang mengalami carpal joint osteoarthritis.
And we can see the left video is before laser therapy and the right video is after. And the cat is not given any not getting any oral medication.
Yang sebelah kiri itu sebelumnya, yang sebelah kanan itu setelah dilakukan laser terapi dan tidak diberikan pengobatan oral.
So let's have a look. Not these two cats. There's another cat coming out.
Ya, ini yang di belakang ya, yang hitam ini.
Okay, so after the laser therapy.
Nah, ini setelah terapi laser.
Yeah, it was. There's just two treatments. So the cat is doing quite well.
Ini hanya dengan 2 kali terapi dan ini perubahan.
Okay. Yes. So now we're going to talk about some common orthopedic problems in dogs. Although in Indonesia there's a lot of cats as well, right? But these things can happen both in dogs and cats. But I'll just go through.
Jadi ini kita akan bahas tentang beberapa kasus yang di masalah pertulangan di anjing dan juga kucing.
You need to drink some water. Yeah, yes, I need to.
Okay.
So hip dysplasia, we call it about CHD.
Ngomongin tentang PHD, dysplasia.
This can also happen in some cats as well, especially for those cats with special breed.
Jadi ini bisa terjadi pada kucing juga dengan breed tertentu.
So the main thing is they have an abnormal development of the coxofemoral joints.
Jadi perkembangannya itu abnormal di sendi coxofemoralnya.
In cats, what we see more common is we can see like fracture of your femoral head.
Kalau di kucing biasanya kita bisa lihat fraktur di area coxofemoral.
And you can cause it. So the CHD, the hip dysplasia, can cause subluxation or luxation of the joint.
CHD juga bisa menyebabkan subluxasi atau luxasi sendinya.
So how can hip dysplasia happen? It can be caused by the genetic problem, like in some dogs, like retrievers, boxers, or like Pomeranians. Or it can associate with inappropriate exercises, or the muscle strength is not good enough, or excessive nutrients like calcium.
Jadi CHD ini bisa disebabkan banyak hal seperti yang sudah ada di layar ya. Itu bisa karena turunan, exercise yang tidak tepat, dan selanjutnya.
And in cats, it's hard to discover. Mostly in cats, if this cat has some hip problem, you can see the cat is not moving very well, or sometimes he has difficulty to jump up.
Pada kucing itu lebih sulit karena biasanya melihatnya dia sulit berjalan atau dia nggak bisa lompat.
So in dogs, you can discover that the dog has a waddling gait, which we also call as a hip hike. Like the hip will actually move left to the right.
Kalau pada anjing kita bisa melihat di bagian panggulnya ya, panggulnya itu bisa bergerak ke kanan gitu. waiting.
So we used to use a Norberg angle to calculate the hip dysplasia of the dogs, but nowadays the Norberg angle is not an accurate predictor of hip conformation.
Jadi untuk evaluasi si CHD itu biasa kita pakai Norberg angle, tapi sekarang udah nggak akurat lagi, nggak itu akurat lagi.
Nowadays we use pain hip or alpha to do our to grading the hip dysplasia of the dogs.
Jadi kalau sekarang kita pakainya mengacu ke pen hip atau OMA untuk menentukan grade-nya berapa.
So here is the clinical signs of hip dysplasia. The patients might have a restricted hip extension.
Jadi ini ciri-ciri hip dysplasia, dia itu punya ekstensi panggul yang terbatas.
Do you guys know about hip extension? You know which way is it? Like in human, when we're putting our hip joint to the back, this is what we call hip extension.
Jadi caranya itu kita panggulnya itu ditarik ke belakang, itu gimana cara kita mengevaluasi hip extension.
So if hip dysplasia happens, we can do four things to help these patients. If we found that if the hip dysplasia in 16 to 18 weeks, we can do these two surgeries: the triple pelvic osteotomy or the juvenile pubic symphysiosis. We also call it JPS.
Jadi kalau pasiennya itu 16 sampai 18 minggu itu bisa dilakukan osteotomi.
Or if we can find it, if the hip is luxated, we can do a total hip replacement, or we can do a femur head and neck osteotomy. But after this surgery, these dogs or cats, they need to go to rehab.
Nah, kalau hip luxationnya itu karena trauma, setelah dilakukan treatment replacement itu atau osteotomi, kita harus melakukan rehabilitasi juga.
And if these patients didn't do any surgery, and after the patient is more than 5 or 10 years old, osteoarthritis can happen and causing muscle atrophy. These dogs or cats needs to do rehabilitation as well.
Jadi kalau tanpa operasi pun, kalau pasiennya itu udah umur 5 tahun ke atas, dia bisa mengalami osteoartritis, jadi bisa dilakukan rehabilitasi.
So here is one of our case study.
Nah, ini salah satu kasus kita.
So this dog is called Le.
Ya. Namanya Le.
It's do you have Welsh Corgi in Indonesia? This breed, yeah. Is it popular?
Yeah,
it's popular because this is like the top 1 or 2 popular in Taiwan. Yes. And he is a he, right? Yeah, he is a 4-year-old. When back in 2018, and he has a grade 3 lameness. Grade 3 lameness. I'll show you guys what is a grade 3 lameness in the afternoon. I'll just put it here. And there is pain presented when extending the hip joints, and it's bilateral. And with the left, it's more severe.
Jadi ini pasiennya seekor anjing jantan yang corgi, yaitu kelumpuhannya itu grade 3, kemudian waktu seni panggulnya itu di extending, ternyata dia mengalami bilateral dan yang sebelah kiri itu lebih.
And the neurological examination is okay. And first of all, I gave him Anfaracosip. It's an NSAID. It's an NSAID medication, right? I do it once a day.
Jadi waktu dilakukan pemeriksaan saraf, dia semuanya oke, terus dikasihnya NSAID.
Okay, so this is the video of the first time before giving any medication, but for some reason the video is not working very well.
Ini video pertama ya waktu pertama kali.
And Anyway,
Oke, berikutnya dia.
so we calculate the hip extension, and the hip extension ideally should be 160 degrees.
Harusnya idealnya hip extension itu 160 degree.
I'll show you guys about how do you measure your hip extension in the afternoon.
Nanti bakal diajarin gimana caranya bisa mengukur hip extension.
And the muscle circumference, muscle girth, the muscle mass, it's on the left it's 22 and the right is 23.
Ya, jadi lingkar ototnya itu kanan lebih gede ya.
I'll show this to you guys in the afternoon as well. How do you measure the muscle mass? Okay.
Nanti sore juga, nanti siang juga akan ditunjukkan.
Then we took an X-ray. You can see it's a bilateral hip dysplasia.
Di laporan X-ray ternyata hip dysplasianya dua-duanya.
And it's quite subluxated, so you can see that it's not very good.
Dari lihat itu juga luxasi ya, dua-duanya nggak bagus.
So my plan and goal is to first reduce the pain.
Jadi treatmentnya itu goalnya adalah untuk mengurangi rasa sakit,
And increase the range of motion of the hip joint.
ya meningkatkan ROM-nya juga,
And muscle strengthening
meningkatkan kekuatan dari otot,
and gait coordination.
koordinasi geraknya.
So, first of all, I ask the owner, first of all, when the patient is in pain, you do not touch it or like try to mobilize the joint.
Kalau pasiennya itu lagi kesakitan nggak boleh banyak disentuh, apalagi di apa ya dicoba untuk banyak mobilisasinya.
You treat the pain first.
Obatin dulu pasiennya.
So first of all, I ask the owner to do a heat pack between 40 to 42 degree on the hip joint.
Jadi dokter ini minta ownernya untuk dikasih pad panas 40 sampai 40 derajat.
As well as the gluteal muscle.
Di otot glutealnya.
And then we do the laser therapy around the hip joint.
Dilakukan juga laser terapi di persendian hipnya.
Then we started to do a little bit of hip extension. PROM means passive range of motion.
Jadi dilakukan juga passive range of motion.
And we asked the owner to do hot pack 40 to 42 degree and 10 to 15 minutes prior to the exercise.
Diminta juga di rumah dilakukan 10 sampai 15 menit ini terapi panas sebelum dilakukan exercise.
Once the dog is not in pain or the pain has been controlled, the dog is willing to walk more.
Jadi ketika rasa sakitnya itu berkurang, itu si anjingnya itu akan mau berjalan, lebih baik berjalan.
So once the pain has been better, and I think it's time to increase the range of motion and to focus on our muscle mass.
Jadi ketika rasa sakitnya itu berkurang, itu adalah waktu yang tepat untuk meningkatkan passive range of motion dan juga dilakukan treatment.
So the first time for Lila to visit me, because the dog is in a huge pain, so I gave him the medication and asked the owner to do the hot pack at home. And I started the rehab session after 1 week of giving the medication.
Jadi waktu pertama kali datang, dikasih obat oral dulu, kemudian setelah seminggu rasa sakitnya berkurang baru dimulai rehabnya.
And once the pain has been controlled, then I started to do the underwater treadmill with the laser therapy.
Waktu rasa sakitnya berkurang, dilakukan laser terapi dan juga walking.
And here for doing the laser therapy is first to treat pain as well, and we want to increase the activity of osteoblast.
Jadi kita mau meningkatkan aktivitas dari osteoblast juga.
So this is how after 1 and 2 sessions, the dogs came back. The lameness score has been decreased to grade 2.
Setelah beberapa kali sesi, grade-nya ternyata grade kelumanya itu berkurang dari 3 ke 2.
and less pain has been discovered.
Dan rasa sakitnya itu juga udah berkurang.
And we can also see, I asked the owner to do more, we can do the slow walking.
Ya, jadi setelah berkurang rasa sakitnya itu bisa ditambahi dengan passive range of motion, terus jalan menanjak.
Because we want the dog to have more weight bearing on the hind limb.
Jadi mau supaya beratnya itu di belakang, di kaki belakang.
So I think this is okay. So this is for after we treat for three months, that this patient came with a grade 1 lameness.
Setelah 3 bulan, giginya kurang lagi.
And no pain presented.
Dan tidak ada rasa sakitnya.
And the range of motion has increased to 150 degrees.
Ya, range of motion-nya juga meningkat ya, jadi 150 derajat.
And we keep doing laser therapy.
Kita tetap melakukan laser therapy.
And I think you guys may think that if the dog is not in pain, why we are still doing laser therapy?
Mungkin kenapa ya, kok kan udah nggak sakit, kenapa tetap dilakukan laser terapi?
Because when osteoarthritis presents, you know the cartilage around the joint can be breaking down.
Jadi waktu osteoartritis kan di kaki lagunya itu bisa pecah gitu ya.
So we want to increase the activity of the osteoblast, and we want to put more energy on those cells.
Kita mau memperbaiki osteoblastnya supaya kita mau kasih energi yang lebih besar di area.
So like osteoarthritis can be a very good case because you use laser therapy. So in this case, this dog is not given any oral medication anymore.
Ya, di kasus ini udah nggak dikasih medikasi oral lagi, udah nggak ada pengobatan oral.
We can use laser therapy, like we treat, like you can ask the owner to come every 2 weeks to treat the osteoarthritis.
Bisa diomongin ke ownernya balik per 2 minggu untuk dilakukan laser therapy.
It's not working.
Wait,
It's not working.
Not respond. Komputernya not respond. Wait a minute. Ini banyak.
Bisa dibantu dari sana aja.
Saja, start programnya. Oke.
Dibantu dari sana.
Can you go to the next slide?
Yang macet ini. Udah biar. 24. Studi satu. Ini bawah 34 lah ini. Nah, tadi. Ini udah lewat lah ini.
Next slide.
Next slide.
Oke.
Thank you.
Lewat jangan.
This is the other.
Emang suka ini dong.
And on the word
Suka
another
jadi kadang
huge course, how do you do on your well, how high optimal water level should be?
Bisa aja.
If there is a chance that I can show my experience on maybe I'll show you to you guys next time.
And the water treatment juga ada di satu pembelajaran khusus lumayan panjang, jadi nanti kalau punya kesempatan, next kesempatannya akan dijelasin sama teman-temannya.
Great. So this patient has came to me for a very long time. The first time when he was here is 2018, and now this dog still comes to me every month. Now it's 2024, right?
Jadi ini anjingnya itu udah datang lama banget sampai sekarang juga masih datang setiap bulan.
I'm going to see him this Sunday.
Bakal datang lagi hari Minggu ini.
You can see the color. This was really yellow, and now it's quite white. So.
Ya, bisa dilihat ya perubahan rambutnya juga.
Oh, this is the back. Oh, right. Back in the list. It's actually working a lot more better.
Sekarang udah berjalan dengan sangat baik.
Okay, so now we're jumping to another topic. It's patella luxation.
Kita akan ke next selanjutnya ya. Selanjutnya itu di patella.
Patella luxation is quite common in dogs and sometimes in cats as well.
Patella luxation itu sangat sering ya terjadi di anjing dan juga kucing.
So the patella sesamoid bone encapsulated within the patella ligament, which itself is the distal aspect of the quadriceps foramis muscle tendon, where it inserts onto the tibial tuberosity.
Jadi fascia patella itu bisa disebabkan karena patella ligamen yang di kapsulanya itu longgar.
And the luxated patella can be genetic.
Bisa juga karena turunan.
And it can also be traumatic.
Bisa juga karena trauma.
And sometimes it can happen if all the congenital cause of patella luxation is more frequent in dogs regardless of the age, weight, or breed. So every dog or cat can suffer from patella luxation.
Jadi penyebab luxatio patella itu yang bawaan bisa sering terjadi pada anjing tanpa memandang usia, berat, dan juga breednya.
Hey, so what we do before we plan on patella luxation, we can do tons of surgery. We can do like tracheal wage recessions, or we can do a tracheal block recession. And we also do the soft tissue imbrication. Also, TTT, tibial tuberosity transplantations can be done.
Waktu ketemu luxatio patella itu bisa dilakukan beragam operasi.
And I want you guys to remember that if your patients with patella luxation come here when you're doing the laser therapy is going to calm or to soothe the inflammation, but it's not. When you're doing the laser therapy on these patients, you want to let the owner know this is laser therapy is not surgery. So the patella will still be luxated.
Jadi perlu dikasih tahu ke owner bahwa laser terapi itu bukan operasi ya, jadi patellanya itu bisa tetap.
So if the grade of patella luxation is too high, like it's grade 3 or grade 4, it's better to recommend them to do the surgery first, then come back for the laser therapy.
Jadi kalau udah grade-nya itu udah tinggi 3 atau 4 ya direkomendasikan untuk dilakukan operasi dulu baru kembali dilakukan laser terapi.
Okay, and also when we talk about the stifle joints, patella is one main thing. Another one is the cranial cruciate ligaments.
Di waktu kita ngomongin tentang bentuk pergempulan ini, luxasi patella dan juga CCL itu ada bagian dari CCL juga.
So, what's the function of the patella is to stabilize our knee joints.
Jadi fungsi dengkul itu kan supaya bisa menstabilisasi sendi.
And our cranial cruciate ligaments does the same thing.
Dan ligamennya juga berfungsi yang sama.
And sometimes if the patella is already luxated, which means the cranial cruciate ligament has to do two things, has to work two things. It has to help the patella to stabilize the joints.
Jadi waktu patelanya bergerak gitu, CCL-nya juga harus melakukan ekstra ya supaya menstabilisasi patelanya.
And sometimes it can cause the cranial cruciate ligament rupture as well.
Ya, jadi itu bisa menyebabkan ruptur dari CCL.
There's a new paper that if there's about 20 to 30%, I think there is, of the dog, if they have patella luxated, 22 to 41 of the small breed dog, 30% of the large breed dog with patella luxation develop a commitment cruciate ligament rupture.
Jadi ada yang nulis juga bahwa 22-41% dari kambing itu yang mengalami mutasi patella itu juga mengalami CCL.
So here is we'll talk about the cranial cruciate ligament rupture here.
Kita akan ngomongin tentang ruptur CCL.
So the medial aspect of the lateral femoral condyle to the central intercondyle fossa.
Ini ada di aspek medial condylus femoralis lateral terus fossa central intercondylus.
And it prevents the anterior jaw internal rotation of the tibial towards the femur.
Jadi fungsinya itu untuk mencegah tarikan anterior rotasi internal tibialis ke arah femur.
And it also limits the hyperextension of the stifle joints.
Dan juga membatasi hiperekstensi dari sendi lutut.
So what tests do we do to diagnose cranial cruciate ligament rupture?
Apa yang kita lakukan untuk mendiagnosa CCL? Ruptur CCL?
Draw test.
Draw test.
Draw test. So it's draw test. So we push the tibial forward to see whether it can move around, to move forward compared to your femur.
Jadi kita lakukan draw test ya dengan gerak-gerakan area. Ini berarti lagi.
Baterainya.
You're doing good. So here is the video of the cranial ligament rupture.
Videonya dari ruptur CCL.
You can see so most of the time you can see lameness
Kita bisa lihat adanya kelumpuhan ya.
and pain and joint fusion.
Tangan, terus rasa sakit, sulit untuk
PT-nya kompres.
And difficult rising
sulit untuk berdiri,
and muscle atrophy.
atrofi otot.
You have to wait. This one, this is the next one. Is it? Okay. All right.
Next.
Okay. So what we can do with the cranial ligament rupture?
Jadi apa yang bisa kita lakukan dengan ruptur CCL?
We can do a conservative treatment if the patient is not too heavy.
Kita bisa lakukan treatment itu ya kalau nggak terlalu berat.
We can do weight control and pain control.
Kita bisa kontrol beratnya dan juga untuk mengontrol rasa sakit.
You want to minimize muscle atrophy
Kita akan mengurangi kemungkinan atrofi ototnya
and maximize the joint mobility.
dan meningkatkan mobilitas.
So these, how we can do, we have to go to rehabilitation.
Ini yang bisa kita lakukan dengan rehabilitasi.
laser therapy, it's very important here for the conservative treatment because it helps the muscles to control. It helps us to control pain.
Jadi laser terapi ini berfungsi untuk mengontrol sakit
And decrease the inflammation.
dan mengurangi peradangan.
However, in some situation, if the patient is too painful or the conservative treatment is not working very well, we can do a surgery like extracapsular techniques.
Ya kalau di kasus-kasus yang lebih berat lagi kita bisa lakukan dengan operasi.
And after finish the surgery, he can go to rehabilitation about 2 weeks after surgery.
Setelah operasi bisa dilakukan rehabilitasi 2 minggu setelah operasi.
And in some big dogs, like more than 20 kilograms,
Di anjing besar lebih dari 20 kilo,
a TPL or TTA should be considered.
ya TPL atau TTA itu perlu diperhatikan, direkomendasikan.
And over here, I put rehabilitation 4 to 8 weeks after surgery.
Ya, rehabnya 4 sampai 8 minggu setelah operasi.
But during this time, before you can do actual rehabilitation, you can do laser therapy at a day after the surgery to increase the wound healing and decrease the inflammation.
Jadi selama itu bisa diberikan laser terapi sehari setelah operasi untuk mengurangi rasa sakit dan inflamasinya.
Oh, so this one is our next case. It's Miru. It's a 8-year-old intact male long-haired Chihuahua. Is Chihuahua popular here as well?
Chihuahua populer ya, populer.
Yeah, and it has a grade 5 lameness. A grade 5 lameness means the dog is not using this limb to walk.
Di perpindahannya grade 5, dia udah nggak pakai kakinya untuk bergerak.
And the dog is in very huge pain because when just touching the stifle.
Jadi sangat sakit waktu disentuh.
And the draw test of this dog is positive.
Jadi kalau tesnya positif,
And first of all, the owner does not want to do the surgery for some reason is because the patient is less than 5 kilograms.
jadi orangnya nggak mau dilakukan operasi karena kurang dari 5 kilo beratnya.
So we tried to do the conservative treatment. We gave him some pain control, include glucosamine.
Jadi kita pakai konservatif treatmentnya, antiinflamasi dan juga glukosamine.
Next one. So observation, we can see the dog has swelling of the right stifle and holding up the right hind leg.
Jadi bisa dilihat itu bengkak di sebelah kanannya.
You can see the toe touching. And when the gait assessment is grade 4 to grade 5 lameness on the right hind leg.
Jadi waktu dia jalan sama berlari itu ada di grade 4 dan grade 5.
And we can see a pet sign when we're showing on the X-ray. We can see within this triangle, the opacity of your X-ray should be low.
Kapasitasnya harusnya kan rendah ya.
And however, if the cranial ligament has been ruptured, we can see the increase of the opacity of this fat pad.
Kalau ruptur TCL berarti kapasitasnya itu.
So the patient is not doing very well with conservative treatment. So the dog came back and we did an extracapsular stabilization.
Jadi tidak membaik dengan konservatif treatment.
And after 2 days, the dog is discharged from hospitalization.
Jadi dilakukan stabilisasi ekstrapapular, kemudian setelah dia pulang ke rumah.
During these 2 days, we do cryotherapy. We ice pack therapy. Ice pack, we put it on 10 minutes on the stifle. Then we do laser therapy at the stifle as well.
Jadi selama di rumah sakit dilakukan terapi pakai ice pack, kemudian di laser juga.
So after 8 days after surgery, the dog came back for revisits.
Setelah 8 hari setelah operasi datang lagi ke klinik.
You can see this dog still holding up the right hind leg occasionally.
Jadi tetap lumpuh dari sebelah kanan.
And the gait is still not very good. It's still holding up the hind limbs at the time.
Ya, geraknya juga nggak begitu bagus. Masih mengalami kelumpuhan, kepincatan juga.
And my suggestion is to do a regular clinic rehabilitation to prevent continuous muscle atrophy.
Jadi direkomendasikan untuk dilakukan rehabilitasi reguler untuk mengurangi kemungkinan terjadinya atrofi.
And the owner disappeared for 3 weeks.
Kemudian ownernya hilang selama 3 minggu.
And when the owner showed up, he called and mentioned that after 3 weeks of surgery, the dog is still limping. So she made an appointment for rehabilitation.
Jadi setelah 3 minggu hilang, ownernya balik lagi bilang kalau setelah operasi tetap pincang. Jadi dia balik lagi untuk melakukan rehabilitasi.
So this is the 4 weeks after surgery.
Jadi setelah 4 minggu setelah operasi.
You can see the dog is still holding up the.
Ya, kita bisa lihat ya kondisinya.
I think there is a video. No video? Okay, no video. So we do a palpation and evaluation. We can see the stifle still, the extension of the stifle has been restricted.
Jadi waktu dilakukan palpasi dan eksaminasi, kita bisa lihat ekstensinya itu masih terbatas.
And hyperflexion of the right heart may be associated to the muscle loss of the limb.
Kanannya itu dia hyperfleksi.
And decreased muscle tone and muscle mass of the right hind limb compared to the left.
Dan ototnya juga udah mulai kurang.
So the problem of this dog is mild spasm of the quadricep muscles of the right hind limb, decreased range of motion of the right stifle joint, and the muscle circumference of the right hind limb is very low.
Jadi otot quadricepsnya itu ada spasm, kemudian lingkar ototnya itu yang kanan lingkar ototnya itu berbeda satu dengan yang lain.
So what we do is, because the dog is still obviously in pain, right? So we do the laser therapy. We put it 6 joules per centimeter square, and we do a massage, release the quadriceps and hamstring, and after that we do a therapy on the hamstring and the right side for 10 minutes.
Ya, jadi setelah operasi kan masih dalam kesakitan, jadi kita lakukan terapi, kita makan juga, kita lakukan termoterapi.
We still do the TENS, which is an electrical stimulation.
Ya, kita lakukan TENS juga, stimulasi elektrik.
Okay, we don't have the videos.
Ada videonya.
It's still very painful.
Sangat kesakitannya masih.
And we do and after one rehab session, the dog has been a lot better. It's more able to put the right hind down.
Jadi setelah satu sesi dia udah mulai jauh membaik, bisa mulai numpuk kaki kanannya.
And we start to encourage the dog to do more walking and do more weight-bearing training. Jadi
kita harus bikin supaya si anjingnya ini bisa lebih banyak dilakukan berjalan ya, terapi jalan.
Doctors might be very curious about these in-clinic rehabilitation. Which one is the first? Which one should go first, and which one should go second?
Mungkin bingung mana yang pertama kali perlu dilakukan, mana yang pertama, terus mana yang kedua.
For me, thermal therapy, heat on quadricep and hamstring of the right stifle should be the first.
Jadi yang pertama itu harus dilakukan termoterapi dulu.
Then we do the laser therapy.
Baru habis itu di laser terapi.
Then we do the massage and release the cortisol and hamstring.
Setelah itu dilakukan massage.
Then the passive range of motion.
Kemudian passive range of motion.
Tense. Active staining.
Ya, aktif
staining. And cryotherapy in the end.
Terakhir cryotherapy.
The order should be like this because what you passively increase the range of motion and ask the dog to stand active exercise, which can increase the muscle mass.
Jadi urutannya harus seperti ini. Ketika dilakukan passive range motion, terus dia kemudian berdiri, itu bisa meningkatkan aktivitas ototnya.
And after a few sessions, the dog is much more better. So I do some therapeutic exercise to train the muscle.
Jadi setelah beberapa treatment, anjingnya itu sudah mulai membaik. Jadi dilakukan treatment yang lebih aktif.
Okay, so this is the cavallari, the cavallari, to walk through the port.
Jadi ada namanya cavallari, itu nanti si anjing itu harus melompat.
没有，他脚抬得好高，
因为它还是有用，所以
给吧，拜托。
This dog, so this dog needs a lot of encouragement to move.
没有，他脚抬得好高，
因为它还是有用，所以
给吧，拜托。
Okay, so we have another one. I think it's here. It's this one. Okay, and and after 19 weeks after surgery, still come here for the rehab. You can see how this dog walks. Although it works very well. Yeah, and so rehabilitation plays an important part in this case because in our thoughts that when your patients have surgery, the owner may think, oh, if the surgery fixed everything, the dog should be able to walk after the surgery. However, there is also some other effects that causing the patient still not walking very well, like pain, or there's muscle spasm, or there is some the dog is afraid to use that limb. This problems can be solved by doing rehabilitation. Okay, so this is what we're going to talk about in the afternoon, but I think I'll jump to the cat one. This is what I'm going to show you guys in the afternoon. And there is another. I jump to the cat one.
Yang kucing ini nge-lag karena videonya berat. Nge-lag dok.
Is that okay?
It's lagging. It's loading.
Oh, it's loading?
Yeah.
Oh.
Lag.
Where's that?
Oh my god.
the delta is so big.
Yeah.
Yeah, it's very
Yeah.
big. So it's not
Can I jump to
the cap.
No, more. I hope there's no cat one. I thought there's a one for cat. Nggak ada yang lewat. Oh, it's okay. Then we can start here. Good. Yeah, but not this one. So, yeah, we can do with this one euro. This one. Yeah, you can start from this one. Okay. What number is this? 77.
Okay, so we're jump to because we're going to do the data analysis and evaluation in the afternoon. Now we'll start with the biomodulation therapy in neurological patients, which Dr. Felicia showed a lot of cases we have done these years. So there are some papers that show that it's very useful when you're doing your photobiomodulation on spinal cord injury. As we talked about that the laser therapy can increase the axon sprouts and to have a good effect on treating these neurological problems.
Jadi udah banyak tulisan yang menyatakan bahwa laser terapi itu baik untuk masalah tulang belakang ya, tulang belakang.
You go to the next one. I think this is not great. Okay. This is a paralysis caused by because this dog came to the hospital with a very poor ability to walk, and the doctor has diagnosed of lumbar disc herniation.
Ya, anjing ini datang ke klinik itu dengan dia nggak bisa jalan, kemudian diagnosanya itu hernia di area lumbar disc-nya.
And after discuss with the owner, the vet planned to do a conservative treatment for this dog.
Kemudian dokternya itu merencanakan dengan konservatif pengobatan konservatif.
And they use a built-in IVDD protocol.
Yang mereka pakai protokol IVDD.
Yeah, and they use like daily, once every week.
Yang dia pakai 1 kali seminggu, setiap hari dalam minggu pertama.
And the second week they do it like every other day.
Dan di minggu kedua dia lakukannya 2 hari sekali.
And after 2 weeks of treatment, the dog can walk and run with the support of the wheelchair.
Setelah 2 minggu itu bisa berjalan dengan kursi roda.
And in my opinion, for these like IVDD case, it's very important to restrict the animal's activity for 4 weeks.
Jadi menurut Dr. Lin, ini penting untuk membatasi pergerakannya dalam beberapa minggu.
The dog can still walk actually, but no jumping and high slippery for 4 weeks.
Jadi selama 4 minggu, artinya boleh jalan tapi nggak boleh lari, nggak boleh loncat, kemudian di jalan di lantai licin itu nggak boleh.
So here is my another case study for IBDD.
Ini kasusnya yang lain untuk IBD.
The name is Hane.
Namanya Hane.
Hane, do you know what Hane means?
Hane artinya ada yang tahu Hane?
It means money in Japanese.
Artinya uang.
So that's why the owners use Hane as the dog name. It costs a lot of money.
Jadi dengan nama yang Hane karena dia menghabiskan banyak uang.
So it's a female nurtured dachshund.
Jadi dachshundnya itu sudah disterilkan.
It's a household pet, an indoor dog, and the owner has owned Kane since she was a puppy.
Sudah ada dipelihara sejak masih anak anjing, masih kecil.
So on 2017 September, Kane was not able to ambulate on the hind legs.
Jadi tahun 2017 itu dia kita menggunakan kaki belakangnya.
And it drags the hind legs when walking.
Diseret-seret kaki belakangnya waktu jalan.
And it showed a lot of pain when touching the back.
Ketika dipegang punggungnya itu sakit.
However, the spirits and appetite were okay.
Spiritnya dan juga nafsu makannya itu bagus.
And the dog is not able to urinate and defecate.
Tapi dia nggak bisa urinasi dan defekasi.
And here is our physical evaluation. We can see the dog is reluctant to walk and got hunched back when standing.
Jadi kesulitan buat jalan dan juga ada hunchbacknya ya waktu dia berdiri.
And it's a grade 0 absence of purposeful movement of the hind limb. It's paraplegic, or we can say it's paralysis.
Nah, ini terlihat paralisis.
And here we can see how this dog walk. That video.
Bisa lihat videonya ya gimana dia jalan.
Cannot play.
Sorry nggak bisa di play.
And here is the neurology examination.
Ini eksaminasi sarafnya.
You can see the and the side to reflex is hyper.
Jadi ada hiperrefleksi di papilannya.
And you can see here the cranial tibial reflex and the gastro reflex. It's fairly normal.
Cranial tibial sama gastromusnya itu normal.
And we did a cutaneous tongue reflex. And it's abnormal around the L4 region.
Jadi abnormal di area L4.
And the most important thing is this the CP is knuckling on the both hind limbs.
Yang paling penting itu CP-nya itu ya ada knucklingnya.
And it's upper motor neuron sign on the both hind limbs as well.
Upper neuron motornya di kedua kanan kirinya.
So we also do a neurology examination. We test for if there's any deep pain on the hind limb.
Kita juga lakukan apakah ada rasa nyeri.
We do the CP placement to see whether there's any good reflex.
Kita lakukan juga CP placement melihat apakah ada refleksnya.
In the cutaneous trunci reflex.
Kita lakukan cutaneous juga.
And the gait analysis.
Analisis.
I think this is a video.
Ada videonya.
Yeah. Yeah, there is. Yeah, there is still deep pain. Still does a good time.
Tanda yang baik.
However, the placement is quite bad.
Ya, tapi placementnya tidak bagus.
And we do the cutaneous trunci to see if there's any reflex.
Kita lihat
没有夹到，因为这个歪掉。
ada refleks.
But the dog is not able to use the hind limb to walk. And sometimes it's when the patient is paralyzed. The paralyzed means there's no movement of the hind limb.
Jadi ketika pasien itu paralisa, berarti nggak ada pergerakan di kaki belakangnya.
But sometimes you can see those patients, he still has some movements on the limb, but not able to stand up themselves.
Kadang tapi masih bisa berjalan, bisa digerakin, cuma nggak bisa berdiri.
We call it paralysis.
Kita sebut itu jadi paralysis.
It's very different to paralysis.
Itu sangat berbeda ya dengan paralisis.
So the patient went for a CT scan, and it's Hansen's type 1 intervertebral disc disease of L2 and L3.
Setelah dilakukan CT scan, ternyata didiagnosanya.
We can see this. There is a very obvious herniated disc around L2 and L3.
Di herniasinya berat di area L2 dan juga L3.
Next. And we did a surgery on the next day.
Kita lakukan operasi di hari selanjutnya.
And we remove the material of the herniated disc.
Kita angkat material dari diskus hernianya yang.
Next one.
Next.
So our rehabilitation starts from the next day of the surgery.
Rehabilitasinya dilakukan setelah sehari setelah operasi.
So pain relief.
Mengurangi rasa sakit.
And we want to reduce the surgical edema and inflammation.
Untuk mengurangi edema dan inflamasi.
And we want to maintain the muscle mass and reduce muscle spasm.
Kita mau menjaga agar otot massnya itu tetap ada dan mengurangi spasm.
And we want to restoration of the proprioception of the limbs.
Nanti di akan
Mengembalikan proprioception dari kakinya.
And increase and enhance the strength of the core muscle.
Dan menguatkan dari otot-otot di kaki.
So laser therapy plays a very important role for pain relief and reduce surgical edema and inflammation.
Pointernya udah bisa.
Terapi ini sangat berperan penting di fungsi nomor 1 golongan nomor 2.
Normally, when we do this, when we apply laser therapy, we don't do laser therapy on the day of the surgery. We always do it 12 hours after the surgery. It's the next day. The reason why is because, do you guys remember that laser might produce some heat? So when your wound is very inflamed, like just after surgery, if you do the laser therapy, sometimes you make the hemorrhage a little bit worse. So in my opinion, is you do the laser therapy 12 hours or the next day after surgery.
Laser terapi lebih bagus dilakukannya 12 jam setelah operasi itu minimal, atau lebih bagusnya ya besokannya aja.
We let the inflammation and the swelling comes down a little bit, then we do the laser therapy.
Kita biarkan dulu inflamasi dan juga pembengkakannya itu berkurang sedikit, baru dilakukan laser terapi.
But within this 12 hours, we can still do some rehab to treat the wound.
Tapi selama 12 ini kita masih bisa tetap lakukan rehab untuk mengobati.
We can do cryotherapy. We can use ice pack to soothe, to make the hemorrhage and edema a bit better.
Kita bisa lakukan cryotherapy, berikan ice pack untuk mengurangi inflamasinya.
And do the ice pack on your treating area for about 10 to 15 minutes.
Bisa dilakukan di area itu sekitar 10 sampai 15 menit.
And you can do it every 4 to 6 hours.
Bisa dilakukan 4 sampai 6 jam.
Okay. So this is what we've done. See, you do the cryotherapy 10 minutes to L2 and L3, and we do a little bit of massage, massage and pesticide. This is a bit difficult for you guys because it's a kind of technique of massage.
Jadi kita lakukan cryotherapy, terus kita lakukan massage
spesial.
And now we do the laser therapy the other day.
Kita lakukan laser terapi di hari selanjutnya.
And we do TENS. This is the electrical stimulation.
Kita berikan tes juga.
And we do it. TENS is a specific a specific wave of electrical stimulation.
Jadi tes itu spesifik, gelombang yang spesifik ya.
It treats pain as well.
Ya juga mengobati sakit.
So the patient was done on the 17th of September, and this is like 5 days after the surgery.
Dan ini 5 hari setelahnya.
The dog is still not able to bear weight, still needs some assist of using the towel.
Jadi tetap nggak bisa mengangkat kaki belakangnya ya.
However, it's gradually to use the limb. The dog is not paralyzed anymore, so you can use a little bit of the hind limb.
Jadi anjingnya ini nggak paralisa lagi, tapi udah bisa dipakai kaki belakangnya, cuma belum kuat aja.
In this video, there is one thing that is quite bad. Do you guys know what it is?
Ada yang nggak bagus nih di video ini. Bisa dilihat apa?
The floor is a little bit slippery. It's
Jadi,
better, when you're testing your gaits, it's better to use like a yoga mat to put it on to let the dog walk or to see how it works, because this floor is a little bit slippery, which may cause some. The evaluation might not be so specific.
Jadi kalau bisa dipakainya kayak yoga mat aja supaya lebih oke evaluasinya.
So here is the neurological examination. So you can see the after 5 days, the neurological examination has become has become a little bit better.
Jadi 5 hari setelah operasi bisa dilihat eksaminasi sarafnya itu baik.
Still knuckling of the hind limb.
Ya, tetap knuckling di kaki belakangnya.
And after 5 days, the dog was discharged on 22nd of September.
Setelah 5 hari dipulangkan, dirawat jalan.
Gave him some antibiotics and the pain control and the vitamin B12.
Jadi dikasih obat oral ya, antibiotik, NSAID dan juga vitamin B12.
And we asked the owner to do the ice pack 15 minutes around the surgical sites twice daily.
Ice pack-nya juga tetap dilakukan 2 kali sehari.
And try to do the passive range of motion to extend and flex the high knees 10 times per cycle.
Jadi lakukan juga passive range of motion 10 kali per siklus.
And we ask the owner to do the assist standing 1 minute twice a day.
Jadi dicobain berdiri 1 menit enggaknya.
And here, restriction of the active area, no jumping.
Dan harus dibatasi pergerakannya dan tidak boleh lompat.
Okay, so this is 7 days after the surgery. Still, the dog is not able to bear weight on the hind limbs.
Jadi 7 hari setelah operasi tetap tidak bisa mengangkat badannya.
Still knuckling.
Tetap knuckling.
Yeah. And on the 30th of September, we discovered that the knuckling has improved on the left side, which the dog is able to put the hold back after 4 seconds occasionally.
Di waktu 30 September itu tetap knuckling, tapi ternyata yang sebelah kiri itu bisa kembali setelah 4 second.
So, after 2 weeks, still back pain on the L2, L3 region.
Ya, tetap ada rasa sakit di L2, L3-nya.
And loss of full proprioception of both hind limbs.
Kehilangan proprioception di kaki kanan kiri belakang.
And spasm of the quadriceps and longitus muscles.
Jadi otot-otot itu juga ada spasmnya.
And we want to maintain the muscle mass and prevent atrophy.
Yang mau menjaga untuk masa ototnya dan juga menghindari terjadi atrofi.
So pretty much in
Short wifi.
clinic rehabilitation, we still do a cryotherapy, massage, passive range of motion.
Ada apa?
Jadi di klinik juga tetap dilakukan cryoterapi, massage dan juga passive range of motion.
And here, the bit here, yours is pretty much the same.
Ya, kurang lebih mirip.
Yeah, and the CP has become a bit better.
Nah ini lebih oke, lebih bagus. Intinya.
So here, the knuckling is able to push the pole back after 2 seconds like each.
Meningkat jadi 2 detik.
And the patella reflex and the side reflex has become normal.
Refleks-refleksnya itu jadi normal.
And here is the part, so it's about 3 weeks after surgery, still a little bit of pain. The pain has been well controlled by the laser therapy, and still the spasm of the quadriceps and longus muscles.
3 minggu setelah operasi tetap ada sakit tapi bisa tetap bisa di-maintain dengan laser therapy.
And after 3 weeks, we start to do a little bit of therapeutic exercise. We help the dog to stand on the yoga ball to do the core muscle training.
Jadi setelah 3 minggu operasi mulai dilakukan terapeutik yang lain gitu menggunakan bola yoga.
And we also put the therapeutic ultrasound here to make the spasm of the back muscles, to release the back muscles.
Jadi dilakukan juga urutan sound terapeutik ya.
Okay, so after 3 weeks, the dog was quite able to bear weight.
Jadi setelah 3 minggu mulai kelihatan bisa angkat badannya.
By itself, but you can see the dog still falls over sometimes.
Ya, sendiri ya, angkat badan sendiri, tapi ya kadang-kadang jatuh lagi. Next.
And next. So on the 13th, this is about the 4 weeks after surgery. The loss of full proprioception of the both hind body has become better and better, and spasm of the quadriceps and longus muscles, and we want to maintain the muscle mass and prevent atrophy.
Ya, jadi 4 minggu setelah operasi, yang 3 poin di atas itu sudah membaik.
So we're giving pretty much the same. We're still getting lasers to help the spine to regrow.
Ya, kita tetap lakukan laser terapi supaya tulang belakangnya itu baik.
So here is 4 weeks after surgery. You can see how the dog walks.
Ini 4 minggu setelah operasi, anjingnya jalan.
You can see there is less stumble has been discovered, but there is one thing that is not so needs to be improved is this dog is still like bunny hopping on the hind leg.
Jadi pergerakannya udah membaik, tapi masih ada seperti lompat-lompat kelinci ya.
The bunny hopping means the dog is still not have enough muscle strength.
Bunny hopping itu artinya otot-ototnya nggak cukup kuat.
Normally, the dog when they're doing the walking or like pacing, they should walk on step by step.
Jadi normalnya ya harus jalan langkah demi langkah.
And pretty much the neurological examination has become better and better, and even the right hind limb, the knuckling has improved.
Ya, eksaminasi sarafnya itu makin hari makin bagus, dan juga di bagian kaki kanan belakangnya itu juga meningkat.
Okay, so here is the listing of the problems. Generally the honey is doing quite well. However, we can see that the dog is still swinging the right hind limb when walking.
Jadi bisa dilihat dari kaki kanan belakangnya itu masih diayunkan waktu jalan.
So this means there is still some neurological deficit of this dog.
Jadi menunjukkan bahwa ada defisit saraf masih ada di sana.
And then we started to do some therapeutic exercise. We do a little bit of like weight shifting exercises to train the muscles and the coordination of this dog.
Jadi kita lakukan therapeutic exercise itu di swing gitu ya kakinya.
And 7 weeks after the surgery, the dog is able to bear the weight on the hind legs.
Ini 7 minggu setelah operasi, anjingnya itu udah bisa angkat badan, angkat kaki belakangnya.
And the dog is standing quite well.
Berdiri dengan cukup baik.
And the reflex has been all normal.
Refleksnya juga sekarang jadinya normal semuanya.
You can see the neurological test showing.
Bisa dilihat ya neurological testnya.
Okay, so the problems is still a little bit of age deficits. We can, when we look very closely.
Ya tetap masih ada kekurangan waktu dia berjalan langkahnya.
And because the dog's owner is very keen to want to her dog to get originally like walking very well.
Jadi ownernya itu mau supaya 100% kembali seperti normal yang dulunya.
But in my opinion, I think this dog has been good enough.
Ya, menurut Dr. Lin ini anjingnya sudah sangat baik.
So the owner even the owner even want me to do more therapeutic exercise to make the dog's gait better.
Jadi ownernya minta buat lebih banyak dilakukan terapi supaya anjingnya semakin baik.
So we still do here. Originally we do TENS, and now we change it to NMES.
Jadi tadinya kita berikan tes, sekarang diberikan NMES.
NMES and TENS are both electrical stimulation.
Jadi dua-duanya itu stimulasi menggunakan electrical.
But TENS is for pain control.
TENS itu untuk mengontrol rasa sakit.
And NMES is for muscle mass building.
NMES itu untuk meningkatkan massa otot.
Do you guys have like electrical stimulation company that put it on your apps? And you don't have to exercise. You got a 6-pack here. It's the weight. It's the NMES.
Ya itu yang bikin 6-pack itu NMES ya.
But for me, if you want to train your 6-pack, you still have to exercise by using this one.
Ya.
So you have
harus exercise ya.
Yeah, so you have to do the exercise with the MES. It shows a better results.
Ya, kalau mau exercise dengan pakai NMES itu lebih baik.
So here is 7 weeks after surgery. Dog is walking quite well, so less bunny hopping. Can see from the video.
Bunny hoppingnya udah mulai berkurang.
Yeah.
Walaupun masih ada.
Okay.
Oke, selanjutnya.
And we still do a routine neurological examination. There is nothing we can find which is abnormal.
Ya nggak ada abnormalitas.
And we still do the capillary exercise to train the muscle.
Lakukan capillary test lagi. Okay.
And the owner took the dog to swimming, and this is what she discovered. She discovered the right hind leg is not active as the left hind. You can see from the right.
Jadi waktu dibawa berenang ternyata kaki kanan belakangnya nggak terlalu aktif daripada kaki kirinya.
And I told the owner that this might be still a little bit of inability of controlling this the motor neuron.
Jadi ini mungkin salah satu efeknya yang kemungkinan sedikit dia belum bisa ngatur motor neuronnya.
But I still encourage the owner to take the dog to do a little bit of swimming, which can improve the muscles and the neurological deficits.
Jadi tetap dianjurkan untuk tetap dilakukan terapi berenang supaya meningkatkan ototnya.
So what could I have altered in this physical therapy care in this case?
Apa sih yang bisa dilakukan dengan
PT
case terapi ini?
For me, I think this case increased the frequency of physical therapy for the first 3 times because this dog came after the dog is discharged. It came to me every week.
Jadi dari yang setelah dilakukan operasi dia datang setiap minggu.
I think it's better for the patients come twice every week would be a better option.
Jadi kalau 2 kali seminggu terapinya itu lebih bagus.
And I think more laser therapy could have been applied.
Lebih banyak metode terapi bisa diaplikasikan.
And I think underwater treatment could have been applied when Kane was able to walk.
Karena underwater treatment itu bisa diberikan ketika dia sudah mulai bisa berjalan.
And it's because of this case, then so I buy a underwater treadmill.
Ya, karena kasus ini dibelilah underwater treadmill.
So going to briefly talk about the RLT24 laser therapy.
Ini akan ngomongin tentang laser terapinya.
So this is how RWD laser, we got treatment protocols, and you can be done on surgery, or you can just do rehabilitation. And you got 4 different wavelengths. You got 4 different lenses, and you got touch screen, which is very useful.
Nah, ini RWD disediakan dengan fasilitas-fasilitas demikian ya.
So you can reduce the inflammation, reduce pain, and accelerate the tissue repair.
Bisa mengurangi peradangan, mengurangi rasa sakit, dan juga mempercepat perbaikan jaringan.
So this is another case, which is very recently. Okay? It's a neutral corgi. It's got a TPL surgery.
Dan ini ada pasien selanjutnya dia dilakukan operasi.
So for this dog, I only do laser therapy after the surgery.
Jadi untuk kasus ini cuma dilakukan laser terapi aja setelah operasi.
So this is the first time when Noodle come into the clinic.
Nah, ini pertama kali waktu anjingnya datang ke.
So it's quite late.
Sedikit pincang ya.
And the dog is quite fat as well.
Ya, anjingnya juga gemuk sedikit.
Yes.
Next,
Yeah, and we did a laser therapy on Noodle.
kita lakukan laser terapi di anjing ini.
Can I open? Okay, that's yeah, and it came like every week, and we do laser therapy twice every week, and to treat the inflammation and treat the surgical wound, which has a very good effect.
Ya, jadi datang ke klinik 2 kali seminggu, kita diobatin rasa sakitnya dan juga luka ya.
Next. So yeah, this is all for this morning. I show you guys about how laser therapy works and the basic of laser therapy and how we treat and the dosage of laser, how we can use the laser therapy in our case with orthopedic or neurological problem.
Jadi ini kasusnya yang udah selesai hari ini, di mana dokter Lin mengobati pasiennya. Ya, ini dibuka sesi pertanyaan untuk 3 pertanyaan pertama ya.
We can take questions.
Kenalkan namanya, saya dok dari
Perkenalkan, my name is Imala, and I'm from Jakarta. My clinic is veterinary.
Udah selesai.
I have a several question. Okay. For the first, based on your experiences using the laser acupuncture in the term of type 1 and also type 2 in IVDD, have you used only laser or you combine with the electro acupuncture in the stage, if the stage is 4 or maybe 5? which one is more effective? Have you ever differentiated?
First of all, for myself, because I don't do acupuncture, so for me, I don't understand. I do not know those specific areas. Actually, yeah. So, but it works if, like, according to Dr. Felicia's results, you can use specific points, like acupuncture points, to put laser energy inside those areas. But for me, because I only do the scanning way to treat these patients, but I think it both has very good effects, especially in type 1 or type 2. But according to your question, it's very important to restrict these patients' activity. Yeah, if the urological examination has become worse, maybe this dog should go for surgery.
Okay. And then the second question. Have in EGC, case, is it safe to use the laser acupuncture for the long term with a direct to the cat?
To cat, you mean
A cat.
you mean like stomatitis or
Eosinophilic granuloma complex.
ECG? Okay. Do you think it's a long term for in long term?
I think stimulate the muscle maybe.
I think it is combined. It should combine with internal medication. But for long term, I think you can increase the frequency. Right? If you're doing like every 2 weeks, if it has been well controlled, you can longer it to like come back every 2 weeks. You can increase the interval of coming to using the laser therapy. But I think we're not 2 weeks will not be too bad to activate the mast cells. So I think you can increase the interval of using laser therapy in treating the ECG.
And then the question is laser acupuncture is very effective for resuscitation trial? It's like when we use the needle, the dry needle.
Oh, you use the dry needle and use the laser?
Actually, I use the dry needle also with the acupuncture and also with the laser. But as I want to know that
Bisa.
with the laser acupuncture,
Zoom
can
bisa.
you for resuscitation trial?
Zoomnya bisa,
Like,
tapi share-nya enggak. Ini enggak aku share. Coba
maybe
share.
dog is dying
Udah nggak ada
and
juga.
like pinch
Udah
with the
selesai,
dry needle.
selesai scrollingnya udah. Udah
Yeah,
tadi
okay.
itu makanya terakhir question tadi itu. Terakhir.
And the
Bilang,
laser
ada yang mau
acupuncture
bertanya nggak? Kayaknya nggak ada.
And then
Yeah, keep going. It's okay.
in the CCL or ACL case,
Yeah.
do you use the laser with acupuncture with the laser acupuncture with the in RVT we use the knee pattern, right?
Yeah.
You apply directly on the knee or maybe you directly to the ACL or CCL pattern.
But I think the mostly I do
Bentar lagi
is
jangan
I
lupa
do it
cari
because when CCLR or ACL rupture happens, it's not only causing one thing, it's causing a lot of things. It's causing the synovial membrane to be inflamed, and it's causing the swelling of the soft tissue as well. So when I'm doing the laser therapy on these kind of cases, what I do is I scan the entire joint instead of just focusing on CCL. Right. So it's better, even though sometimes I do two parts. I scan the knee, then I treat the muscles as well. So sometimes I do knee protocols, then I do muscle protocols on the quadriceps and even the hamstrings.
Okay, thank you. And then the last question is Average
Average and tetrashot.
is the same with the cleaner? Is the same with the cleaner?
Bisa nggak Pak? Yang mana?
It's Average and tetrashot is a technique of massage. Yeah, so Average is like where you're touching, and tetrashot is more like a little bit like kneading. You're putting a bit of pressure on. So it's both massage, but it's the different techniques. Yeah, so like in human, sometimes they just like touching you, brushing you, and the petricide is more like put a little bit of pressure on your muscles. So they're both massage,
Saya
but
sudah
they're
menggunakan rasa
slightly
terapi.
different. Yeah,
Thank you.
no worries.
Baik, terima kasih. Apakah ada dokter yang lain yang ingin bertanya? Silakan dok.
Itu lagi.
Ya, dok, saya pakai bahasa Indonesia itu yang perlu dibantu di translate. Apakah untuk dosage laser terapi untuk hewan eksotik yang kecil atau small mammal itu sama atau beda? Karena kan kayak kepikiran ototnya juga beda gitu. Misalkan untuk burung apakah sama segitu jauh juga? Kemudian pemberiannya tetap sama untuk setiap hari. Karena saya ada case burung dicoba laser, kemudian nggak tahu ya lasernya atau bukan, berapa minggu kemudian ada bleeding.
Okay, so the question is, are there differences about the dosage between the exotic pets to the animal, small animal?
I think there is because what I said in the very beginning is there is four things can happen when laser strikes tissue. It can be scattered, it can be reflected, it can be absorbed, and it can be penetrated, right? If you're doing the exotic animals, if the wound is under the skin, sometimes last time in Kuala Lumpur, one doctor is he's doing the elephants. They say, oh, how should I do on doing laser therapy on elephants? Because we all know that elephant has a thicker skin, so the power or even the time and the joule and the dosage of the laser therapy should increase. So it depends on what you're treating on. If you're treating on a very superficial wound on exotic animal, the dosage can be fairly 10 joules per centimeter square. But if you're treating an osteoarthritis in a, let's say a turtle, I'm not sure if turtle has osteoarthritis or not. But if you're treating the patient with thicker skin and you want to treat their muscles or bones, I think you should increase the power, or if you're too scared to increase the power and causing any heat damage, you should increase the time to make sure there's enough energy to go into the tissues. So it depends on what you're treating. If the wound is quite superficial, I think the dosage of the
Pasangin bulu-bulunya Pak.
can be
Noise-nya banyak banget.
But if you're treating
Pasangin
something
bulu-bulunya.
deeper or bigger, the area is bigger, then I think you should increase the time or increase the power of your laser therapy.
Jadi tergantung isi ya dok, ada yang juga ya. Ada pertanyaan dok kira-kira? Is it safe to do it every day?
Yeah, you can do it every day. But for like, for me, for acute phase of these animals, for acute injuries, you can do it every
Oh
day.
nanti.
For chronic injuries, you can do every once
Satu
a
aja.
week or once.
Satu. Dua-duanya.
Oke.
Satu lagi.
Apakah ada pertanyaan dari
Zikir
peserta yang lain? Dokter
Satu lagi Bang Zikir gini.
Kalau mau nanya pakai bahasa Indonesia nggak apa-apa, bisa aja.
Yes.
Oke. Kita perkenalkan diri.
Dari sini,
I'm Vina. I'm Dr. Vina from Indonesia. Maybe Dr. Paris can correct me because my English is bad, Doc.
It's okay.
Okay. Dr. Paris combine acupuncture with the laser therapy. How about you? Acupuncture and laser therapy, are you combined with or not?
First, because I don't do acupuncture, but my residents, he do acupuncture. So sometimes for some like neurological patients, they do, he do dry needle first because he wants the needle to stay for 50 minutes. Then I do the laser scanning during this time. So you can do it at the same time. I think it's okay.
So direct you should probe with the inflammation. That's inflammation.
So, like, you mean the protocol?
Yeah.
The protocol depends on what you are treating. For example, if this is a IBD patient, so you're using the dry needle to put on the back to where you want to treat, then you do the back protocol. There's a IBD protocol in the laser, so you do it while the needle staying inside the patient. You do the scanning, but in that case, you do not use your probe directly because there is needles, right? So you just do a little scan around these areas.
Thank you.
Oke, terima kasih, Dok. Apakah ada yang masih ingin bertanya?
Online
Oke,
kan?
online juga ada yang bertanya. Oke.
When you apply the probe, you use it like circularly, or maybe you use it like a staining line, or maybe.
I do it like slowly scanning, not actually around using the round. It depends on depends on where I'm going to treat.
How about the hips?
The hips,
Yeah.
I do. If the hips, you can do it like
Zigzag.
yeah, you can do it. I'll show you in the afternoon because when we're doing the hips, you can do it. You touch the acetabulum of your and the greater trochanter of your femoral head.
Langsung
You can
cari, Bang.
do all around.
Udah tahu kan dokter
to
itu?
make sure you
Udah
cover
tahu dokter itu? Udah tahu.
your joint
Dokternya udah tahu.
and as well as the
Yang mana?
gluteal muscles and the quadriceps
Cuman
muscles.
ada-
So you are doing not actually all around,
Nanti
but
kita
you're also
bisa cari
doing like
background.
scanning.
Antara auto,
Yeah. Doing like
Background
slowly
tentang RWD.
scanning the entire area.
Background sana aja deh. Backgroundnya tentang konsep RWD. Ya.
Masih ada
Di situ.
yang ingin
Laser.
ditanyakan?
Ya boleh.
I think it's very clear.
Kita
Ya.
tarik aja.
Tidak ada lagi pertanyaannya. No more questions. Okay. I think Dr. Paris is looking very exhausted right now. Okay, it was very full of information. Yeah. Thank you so much for Dr. Yulin and for the integrated Dr. Paris. Hoping that we can also apply the information or the knowledge from Dr. Yulin in our daily basis. Yeah. Okay, the next is okay, next we would like to present the certificate of appreciation to Dr. Yulin that will be given by Dr. Mirjala.